Back in 1996, it was the best of times, it was the worst of times. I had a great booming practice, everything was going well, and then a patient came in with red eyes, much like what John showed, except they were paradoxical. Nobody knew what she had. She had already seen 3 different eye care providers, and they had referred her on to me. And I didn't know what she had either. We didn't have the testing then. But 3 days later, I knew what she had because I had it. I had severe EKC that resulted in a best corrected vision of 20/80. I had severe precipitates in my cornea that required steroids. Lo and behold, when we added the steroids, my intraocular pressure went to 60, and I ended up developing cataracts. Had to have cataract surgery. But the long-term problem that I developed was severe dry eye. I'm talking about to the point of having to lean back and have artificial tears put in my eyes during surgical procedures. I'm talking about giving a lecture in Hawaii and then being asked to come give a program at Park City, which is quite a change in climate, and waking up with searing, severe pain because my eyelid had stuck to my cornea. It was a continual, long-term problem. So I was not only motivated to start a dry clinic for our patients, but I was motivated to get some relief myself. I don't know if any of you have ever heard of Jerry Clower, but he's an old country comedian, and he tells a coon hunting story. And a person gets up in the tree trying to knock a coon out. Turns out it's a wildcat. And he's hollering. He's hollering, whoa, I'm hurting. And finally he said, shoot up here. Somebody shoot up here. He said, no, we can't shoot up there, John. We might hit you. He said, well, shoot up here anyway. One of us got to have some relief. Well, bottom line, I had to have some relief. So, slides.
They dried up.
They dried up over here? Okay. All right. So, how do we start a dry eye program? Here's my financial disclosures. You know, when you're hurting, a lot of times you'll look for spiritual guidance. So I looked to the Bible, and I saw that David understood by suffering. He said, I'm weary with moaning. Every night I flood my bed with tears. I drench my couch with weeping. Now I know that was travail of soul, but it was also could very well have been dry eye, because those of us with dry eye certainly understand it. So our decision was made to start a dry eye clinic. We had key staff members attend Dry Eye University, headed up by Frank Bowden in Jacksonville. We had Jeff Robin came to our practice. We had Laura Perriman came to our practice. I talked to some of the leaders around the country to try to set up a dry eye clinic to help patients in our area and to help me in particular. We selected a lead for the dry eye clinic. It took some time, but we developed a standard of care. I've seen no one that has developed a standard of care better than what John has done. That is absolutely excellent. And if you can get everybody in the practice on the same sheet of music, it makes it so much easier for the practice, so much easier for the patients. We also had a lot of physician meetings to try to get everybody on the same sheet of music. So many people just want to reach over in their sample closet and do this to the patient and hand them a handful of drops and say, try these out, and whichever one makes your eyes feel the best, keep up with it. That is certainly not scientific practice for treatment of dry eye, and it certainly doesn't inspire confidence in the patient. So we presented this standard of care, and we're working diligently to try to get people to adopt it. Staff training, We had to get the techs on board, the front desk on board, everyone on board to better educate the patients and to better educate our staff. Some of the issues during implementation, physicians being reluctant to get on board and change. Some of them preferred not to see dry patients, said that it would take up too much time so that they couldn't see other patients. But as John has pointed out, it could certainly be a significant revenue booster as well. The clinical staff was concerned that it was going to end up taking up way too much of their time and they were going to get way behind. But as we've incorporated this, we've actually found, just like John did, that it has saved us time. We haven't had to have as many revisits. We could actually address the problem at hand, plus we're less likely to have post-operative complications as well by addressing the ocular surface right out of the gate. We also use the speed questionnaire. So we have a lead dry optometrist, a dedicated dry clinic day or days at appointment spots. Some of the physicians are still reluctant. The standard of care is being followed most of the time. The clinical staff has become quite proficient in the diagnostic testing, and the speed of their workups has certainly improved. But most importantly, we have improved patient care and satisfaction. But obviously, we're still learning and adapting. The speed questionnaire is a questionnaire that you could use in the practice. That's a quick screening device to assess the frequency and severity of patients' dry symptoms. And the nice thing about this is you can monitor your treatment outcome with it. And do the speed score, treat, and then see what the speed score is later on. The LipiScan LipiView is very helpful in evaluating dry disease. In fact, Alan Carlson, my good friend over here to the left, taught me into having a LipiView test done. And after he saw the results, he said, you know, we need to call a meibomian gland code on you. And it was one of the worst things. And then Laura looked at my meibomian glands and actually did some scraping on them to try to get me some relief. So I've had the privilege of actually being a patient with these fine doctors. The tear lab, as John has already pointed out, is critical. Having these numbers to show the patient it's nice to be able to show them that they're not imagining things. They actually do have a disease. I actually show them the pink strip on the inflammatory. I normally tell them, no, it doesn't mean you're pregnant. It just means that you have significant inflammation, and that way we can tailor our treatment to the condition that you have. So what do we offer at our practice? We offer artificial tears. Retain MGD and Oasis Plus are good tears to offer. We, of course, offer the Hydro-Eye. It's one of the few nutritional products that's actually been studied. John mentioned his excellent paper that described the kind of outcomes you could get with Hydro-Eye. Avenova, this is an absolutely wonderful adjunct in treating blepharitis. In fact, my mother says it's the best thing we brought into the practice. It really has helped patients with blepharitis, and you can prepare patients for surgery and be much more confident that they won't have any type of infection issue with it. Prescription meds that we use are Azicite and Restasis. My personal history, I've had LipiFlow done twice. I've had Toya's dry treatment 5 times. I've had Pelave multiple times. I've used a lot of different meds, but Xiidra literally has changed my life. 2 days after I went on Xiidra, I was dramatically better. 2 weeks after I went on Xiidra, we repeated my diagnostic testing. I had improved at every category. No, the dry is not mysteriously healed, but it is so much better, and I'm using less medications. So we also do the LipiFlow treatment, as John mentioned. This is the Toya's IPL setup that is very helpful and a useful adjunct in your practice. We use the Pelave device that you can also use for oculoplastic surgery. It has another handpiece that you can use to heat up the meibomian glands. And one of the advantages of it is you can use it on any color patient and not have issues with hyperpigmentation or scarring that you have to worry about with the IPL. So in conclusion, let's look back at the Hippocratic Oath. I will remember, I do not treat a fever chart, a cancerous growth, but a sick human being whose illness may affect the person's family and economic stability. It markedly decreases the quality of a lot of people's lives, and it does affect what they're able to do. My responsibility includes these related problems if I am to care adequately for the sick. I will prevent disease whenever I can, for prevention is preferable to cure. And if you have a good dry eye program, you're able to prevent a legion of problems. If my dry eye had been adequately treated way back in 1996, I wouldn't have all the issues that I have now. Wouldn't have the scarring of the eyelid, the scarring of the corneas. Those are the things that can be prevented, and I would strongly encourage you to adopt a dry eye program.